So I first interacted with robotic few years ago in Chandigarh, where I had a chance to work on a saw-based workshop, where it was only available for the UKI, and that was with the burr. And that put me off, to be very frank, and I was never interested in that, possibly because I didn't like the concept of burr. Then last year I got a chance to go to Florida, where I worked on a saw-based robotic workshop, and I was very much happy and was very much involved in that. Then I interacted with various experts all around the world, especially from New Zealand and America, and got to know much more details about it. And finally, practiced on a cadaver workshop in Bangalore and started my journey in this field. Mind you, I was not a navigated surgeon. So for me, it was a big jump directly from a conventional one to a robotic without navigation. So once a famous arthroplasty surgeon, Jakosky, has said that no industry has ever seen robotic technology being introduced and ultimately not show increase in the production capacity, improve accuracy, and lower the cost. Now, as we have learned in last 3 days, robotics really gives us enhanced surgical planning. It also gives us greater precision and accuracy. But for me, the winner is it gives me a ligament sparing option. I'm always a CR surgeon, and I like releasing less ligaments. So this is an excellent tool to give us less ligament release. Now, as you know, alignment is the key to get successful result because it improves the function, decreases the complication, and optimizes the durability. As against malaligned knee causes accelerated wear, component loosening, and in turn causes pain, instability, and stiffness. Now, it's very interesting. If you see a Google trend search over last 10 years, there is 4 times increase in the patient interest in robotic joint replacement surgery. So it's not a rocket science that all major companies have jumped into robotic technology. Some of them started with UKI, and almost all the major ones have now introduced their robots, right from Cori, Velis, Mako, Rosa, Cubis, etc. And each and every one has got their own advantages and disadvantages. Now let's dive deep into history of robotics. Now first generation robotics actually came into picture in early 2000, where there were 2 prominent robots, RoboDoc and Casper. Now both needed a preoperative CT scan. And early study shows that there was much better accuracy and precision of an implant fit. But unfortunately, it failed to equate to improve clinical results as far as patients are concerned. And there were a lot of technical glitches and intraoperative complications. So that leads to cessation of their use. These all 2 systems, majorly RoboDoc and Casper, were open systems where they were compatible for different companies' implants. So they used to just give us a base as a 3D model for various different companies to use their robo. Now it's great because different companies can use that system, but there was a major downside because once you use different companies' different implants, the predictability of the optimum implant positioning was quite limited. So it doesn't give us exact predictability how our implant is going to do. So almost all the new robotic systems are now closed systems. For example, Mako is for triathlon, Velis is for attune, etc. So coming to image-dependent and imageless robotics, both these systems basically create a specific 3D model. Image-dependent one, you have to get a preoperative CT scan, as against imageless system derives its data from registration of the bony surfaces. And it's very important to have joint kinematics where the movements will dictate how you are going to do the surgery. Now, image-dependent system has one definite advantage that you get sufficient time to do preoperative planning, to choose the implant size correctly, to get the orientation proper. As against imageless system, you have to take all the decisions on table. But the downside of both is in image-dependent system, you have to get patient admitted before extra cost, radiation, etc. While in imageless system, you have to get absolute precision, registration, and good kinematics to get into the proper system. Because as you know, that garbage in is equal to garbage out. So if your registration is not good, imageless system is going to give you poorer results. So there are a number of papers which suggest that preoperative CT scan is required for accurate planning before the robotics. But it also includes extra costs. So patient had to get admitted before, CT scan has got extra costs, which a lot of people are not very happy about. And last but not the least, a lot of people come and say that, look, I don't want a CT scan because it has extra radiation. And mind you, each CT scan is equivalent to 100 to 250 chest X-rays. And again, CT-based system isn't infallible. So if you're thinking that CT-based is absolutely accurate, it's not. Because despite you having knowledge of CT scan, finally surgeons still have to open the knee and mark the points on the patient. So there is a possibility of introduction of human error there. Now again, why saw and not burr? So I'm doing TKR for last 25 years and I'm used to using saw for those many years. I don't want to change to something which I'm not used to using a burr. Secondly, I feel burr creates a lot of bony dust. It can be really messy in the table. It can obscure your vision. Your cuts can be irregular. They are not clean cuts. It's more time consuming, at least in my hands, and it can be really frustrating. And a lot of our surgeons now, like me, we do more than 2 or 3 TKRs a day. So if you're using a burr for that much longer period of time, a lot of surgeons are now complaining of hand pain, neck pains. So there is this factor you have to consider. Now look at this. The burr is producing a lot of dust which can obscure your vision. The cuts are quite bad and irregular, and a lot of time you have to use a rasp to get the cuts right, or you have to use a saw. So when you're using a rasp and saw, you're compromising your precision. And so what's the use of using a saw after using a burr? As against Wellis, which is a saw-based technique, is a very, very slick technique. You've got a very good chance of getting a very clean cut. You can check and recheck. Now I have timed myself. You can finish all the cuts within 4 to 6 minutes. The cuts are very slick and nice. So finally, why go for Wellis robotic? First of all, I am used to doing attune knee for last 10 years, so I do not have to change my system. It's just a technical advancement of the same system which I am using, which is very, very beneficial and crucial. Second, it's a saw-based system which I love. I just hate using the burr. I do not need to have a CT scan. So if the patient decided that he wants a knee replacement tomorrow, we are ready to go. And it's a very compact system. So we do a lot of bilateral knees. So while I am closing one knee, my assistant can change the system and attach it to the other side while I am ready. So just within few minutes, we are ready to go on the other side. So it is very, very user-friendly. So finally, in today's era, you don't want to see a horrible picture like this, where the cut is almost in 12-degree varus. Every time we want to do a reproducible knee on the right-hand side, which is possible with a robotic system. So I feel robotic TKR is here to stay, and in next 5 years, you are going to hear more and more about it. Thank you very much.